Great. Has anyone got a question to start a discussion? Lovely. Sorry, if you could just wait for the mic.
Sorry.
It's okay.
That's better. My question's in regards for Bill, in regards to the paramedic student placements. We take the Bachelor of Nursing and paramedic students as well, and we often get that pushback when they come to a hospital. So I understand how you've had that pushback in regards to aged care. Firstly, with your facilitators, what background are they? Do they come from the paramedics background or do they come from a nursing background? And also, you talked about facilitator training. What was involved with that?
The facilitators are nurses that are typically employed by the agencies that we're placing our students with. They clearly have a lot of experience in facilitating nursing placements, but they don't know a lot about paramedics. So they're really keen to have a paramedic come and talk to them prior to this placement, so we're in the process of doing that at the moment. We're also bringing them in for a half-day workshop to make sure they understand what the placement's designed to do and what their role is and what the students' roles and expectations are going to be. So we did look at the possibility of using facilitators with dual qualifications, because there are a number of people out there who are both nurses and paramedics. We've got several within the team with that background. But at the end of the day, we think that that model that we're running with is going to serve us well. And the second question was... Did I? Fancy that.
More questions? There's never a stupid question, so please ask away. Or anything to share with the panellists.
Oh, this is for you, Ranelle. I really liked what you were talking about, the education resources that the students developed. I'm not sure about the nurses in the room, but from a placement provider point of view, we really can't let our students do anything exciting other than learn nursing care. So this concept that your students were able to develop educational resources for the next group sort of puts that up at that high practice level, and yet we are constantly sort of restricted with that, because often students are these fresh eyes to your organisation that look at your practice and have a lot to offer. But I know with other disciplines there's opportunities for projects and things like that. We haven't quite got there with nursing.
I think what helped was that the resources that they were developing were specifically related to the work that they were doing at that point in time. So it wasn't a project that was unrelated to the work they were doing. So in that sense, it wasn't taking up a lot of additional time for starters, but also they could implement it immediately. So in that sense, it's part of their clinical practice. It's not a project separate from what they were doing. And the reason that we had just hand over the resource to the future group was we didn't want to duplicate anything, and we're hoping that in future, because all of the resources that were being developed will stay behind in the services. So we're hoping that it'll just become a little bit of a library for future students and even for the clinicians there to use. So in that sense, all the student groups add a little bit, but it's not too overwhelming. Does that answer the question?
Yeah. I guess what I had in mind still is related to nursing care, but it might even be things like, you know, we audit our practice, but to get a student involved in auditing your practice, it's not really what they see their role is, and yet we're constantly auditing our practice while we're delivering it in order to deliver really good care. So sometimes I feel that there's restraints on what a student can actually do in their placement, and there's this desperation, I guess, to, well, you've got to take a patient load and you have to complete this, when some of those really high-level tasks is that we want our future clinicians to do are staring them in the face sometimes, you know, and that might even be auditing on pressure area care, that we, you know, those high-level, or medication safety, that kind of thing. Just putting it out there.
Hi, Chris Keach here. I've got a question for Trish. Everyone has a turn. You mentioned that you're going to be putting up some little webcast of additional information from specialists, but you talked more around medical specialists. Have you thought about also including all the allied health specialists as well around particular issues?
The short answer is yes. The reason I didn't say that up there was that because the project itself is actually physically coming to an end very soon, we weren't going to be able to guarantee getting all of the allieds on board in a short time frame. That aside, the infrastructure will be there, and even after the completion of the project, certainly our intention is to continue adding the videos, the short grabs, and involving other disciplines using the allieds, using speech pathologists, using podiatrists, etc. To continue on. I mean, the infrastructure will be there, and the more support that we can get to keep putting on, we'll continue to do it.
Great, thanks.
I'm looking for hands. Great.
Susie, my question for you is I was really interested on your CPD points that you gave the staff for participating in student involvement. Was there a formula that you came up with? And look, it's an interesting concept that aged care professionals might have a greater difficulty in getting their professional development than in the other sector, but I certainly see it as being a really big driver for clinicians to be involved with students. So are you able to talk about that?
In terms of the CPD points, we checked with the, and I'm going to forget the accreditation body now, mental blank, I'm sorry. Yes, and we just double checked that the participants could self-lodge and report what it is that they'd taken part in. We also made sure that we created the certificate so it truly identified what the components of the day were, and determined that it would be roughly, and we noted that it was 7.5 hours, and it should have translated to roughly 1 point per hour, if accepted. We've done similar. We do a lot of training. I spoke about a project we ran in Gladstone where we trained with Allied Health. Most of the accreditation bodies have a similar sort of system, as long as we make sure in those certificates. So it's not the pretty one that has your name in lovely script, but it's certainly detailed every aspect so that it could be judged fairly on self-lodgement.
Great. Any more questions before I thank the panellists? Okay.
For the gentleman who spoke from the paramedic education, I was really interested in that because the idea, the concept itself is totally transferable, which I love. But how are you going beyond the University of the Sunshine Coast with this concept, and how is it being taken up, if it is being, and how are you communicating that across different universities or training bodies?
We're working with, we've got a network of paramedic educators that meet at least twice yearly, where we share knowledge about projects that we're currently working on. I'm actually collaborating with the colleagues at UTAS that I referenced in that article, because we can see some opportunities for collaboration to extend the work that they're doing, so that eventually we can share experiences with our colleagues at other universities. We certainly want to make sure that this project is taken up, if it works well, by other programs around the country.
I suppose also I'm thinking, just in terms of the people who are in this room and the fact that, you know, who we work with in our networks as well, I think it's a really good opportunity for us to be able to share that kind of project in particular as a model of how change can occur. It's a change management process that you're going through internally that I think could be extrapolated across a lot of different disciplines as well. And I guess, since someone else is asking questions at the moment, I'm going to just build on what you were saying also about the clinical placements and about the people who are doing those clinical placements and the opportunity that you have as a business or a facility that is hosting a clinical placement, for them to have an objective perspective on your business, the way it runs, the way care is given, and thinking about what Dominic was saying this morning about the big deal people, and the lady who came in and worked with the frontline staff who gave of their time. And I suppose there's an opportunity there to see the clinical placement, the students themselves as that front line who at the end of a clinical placement sit down and say, what are our strengths, and do a SWOT analysis, if you like, of their experience as well, and see them as contributing to the way care is given and the systems that are developed in the future. That was just a thought.
Great. Any more questions? No. It's like an auction. What was the... No question? Right. I'd just like to thank our presenters today. I'd particularly like to thank them for sharing their lessons learned. I think with some projects, that's the bit we like to just... Let's just wash over that bit. But as Ken said, the good, the bad and the ugly is great for the audience. It really helps put things into perspective, that not every project is perfect, not every project runs to this exact scope, time, that you want to achieve. So I really thank all of you for doing that, and I'm sure our audience feel the same way. So the next session will be starting in about 5 minutes. So if you want to take a comfort break, please do. And thank you. Thank you to our presenters.